Good morning again. This is Dr. Bill Wyatt with the American Orthodontic Society, and I want to talk this morning about experience is a dear teacher, but a fool will learn from no other. Now, this is something that Benjamin Franklin said years ago, and it's certainly true up to a certain point. But there's some difference in the two ways of learning, experience and then learning it from others. And we're out here trying to teach people how to learn from others, but I want you to understand that experience is a better way to learn something, but you can't learn very much from experience in life. You've got to learn an awful lot from others, and you just hope that others are correct. But experience will show you a more correct way to go. So I want to show you a case here that we did that I learned from experience rather than what was being taught at the time. And this, let me get into this now. This is crowded lower cuspid teeth, and we're going to show you this. There was a wonderful teacher from up in Washington State, I think, found out that he thought he was correct in saying that lower cuspid teeth, if you tried to expand them, they would come back within 10 years, back to the place they were. And he had some good material there to back this up. I mean, he showed the teeth spread out and they would come back. Teeth spread out, they'd come back. So he published this, and this was taught all over the country here, that if you expanded the lower cuspids, they were going to come back to where they were. But I just could not believe that there was some secret position to the cuspids, and you'd spread them out, they'd come back to that position regardless of what you did. It didn't matter whether you extracted teeth or didn't extract. If you expanded the cuspids, they would come back to that position where they were. And so people at dental schools all over the country, and orthodontic schools, were extracting lower teeth down here because they didn't want to expand the cuspids, because they thought they were come back to that position. But I got to thinking about this. There's no sacred position for the cuspid teeth. There must be something wrong with what was being taught. And this was such a gentleman fellow that taught it. He was head of the orthodontic school, I think, in Washington, the state of Washington, and I'm not sure about that, but he was a very fine gentleman and a very wonderful lecturer, and I went to hear him talk on this, and I thought, well, this can't be. But I hated to buck what he was saying, but I went away and got to thinking about it, and I said, I've got to show that this is not the truth. It is wrong, even though the man teaching it was very sincere and had some good evidence that it had. But I figured out what actually caused that. So I went and got a patient who had the crowdest cuspid I've ever seen. And I'm going to show you this girl. I've got a lot of pictures. I'm going to just go through them really fast. But this is 1973, and we were banding the full cases back in 1973. And here's this young lady, and she's in a good class 1 relationship. This is fine. Over here, the bite over the other side was class 1 too. And if you've got a class 1 case with a deep bite, something's got to be crowded. I mean, that's just a fact. If it's class 1 and you've got a deep bite, and we did have a deep bite in this particular case. Let me go back here and show this. you could hardly see the lower anterior teeth here. Now, if you're class 1 and you got a deep bite, there's no way you can have the teeth lined up like they ought to be. They'll be crowded as all get out. And that's what came up in this particular case. And so here is the upper arch, and this is 1973, right here when we started this case. And here is the lower arch. And this is, and to my knowledge, this is the most crowded I've ever seen any cuspid teeth. If you put a point here at the point of the cuspid, you go up at the point of this cuspid over here, this is the distance right in here of the cuspids, right here. And now we've got this tooth, this tooth, this tooth, and this tooth to put in there. If you expand those, you just never take out the cuspids, so you would have to expand probably, well, here they've only got room for 2 of those teeth. You'd end up taking 2 of them out. And I said, this is not right. Those teeth can be expanded, and they will stay there if you do it right. And so I thought to myself, how did this doctor who's head of this orthodontic department expand the teeth? How did he do it? Well, he told the students to go and said, no, you've got to expand the cuspid teeth here. And they were in a hurry to do this, to get it through. So the students must have just tilted the cuspids out like this and put the teeth in there. Now, if you do that, the teeth are going to come back to that position because you didn't bring the roots out. So I said, this is what's wrong here with what he said about this. So if you did it yourself, you got to take the roots of the cuspids and go back with them past where you have the crown slightly. And if you pair them there, the teeth tend to stay there. They don't want to go back over this way like this. But if you just tilt the cuspids out like this, they're going to try to go back to this crowded position. So I worked on this young lady, and we were so crowded, and here we came in and took out the bicuspids. Now, they said it didn't matter whether you took them out or didn't take them out. If you expanded the cuspids, this was going to happen to you. So let's follow this case through. All right, we're going to go in, and we took the first bicuspids out on the teeth, on the case, and I spread those cuspids apart, and I put the roots of the cuspids back further than the crowns were, and I went through this case, and this is 1974 now, and we've got room in here. Here the cuspids are over here, and here are the 4 anterior teeth right here. This was back when we had to band everything. That's just the way we did it, and I'm going to show you the x-rays and everything on this case, and we'll follow it. And I followed it for 10 years after we finished this case up. And you can see we're getting in place, and we continue to straighten them up until we got the teeth fairly straight. Now, as I brought that one through, the root was back here, so we had to put a reverse torque on it and pull the root forward and keep the teeth lined up, and we lined these up, and here are the cuspid teeth over here now, and we take the bands off and line this up. And this is 1975. In other words, we've been working here for a couple of years, and we got the teeth lined up, and this is 1973 when we started, and this is an old Patarex, and they're just in here. They're crowded up in this area. So we go into 1975. We had lined them up, and these cuspids were in here, and these are cuspids. The bicuspid, we take the first bi out. I did take the first bis out of the case. Now, here it's 1976, 1977 or something, I believe, like that. And we finished this case up, and we lined it up, and I probably bonded something on those cuspids. Now here is the young lady after she grew up, and this was several years later, and this is the profile. It's slightly in a little, but I took the bicuspids out because of the extreme crowded condition, and we lined those teeth up, and this is after she got further along. Now this is when we started. You can see she was kind of full in the face, and we treated that and flattened it out a little. And here she is. I think she's 30 years old here now, and this is the profile. As you see, you got almost a perfect division in the facial structure and everything right here, 30 some years after, or 20 years after we started this. All right, and I'm going to run through these pictures real fast so you won't have to spend too much time there. This is the tooth. We had to put reverse torque to bring this root of this tooth out with these teeth. And we put that in a rectangular wire. You'd have to change the torque right in between there and put that reverse torque in it, and it would bring the root of that tooth out. And so we let you watch it, it goes out. Now we're closing the space up above, and we will be closing this down below. We still haven't got that root, it's still back further than the other tooth right there. And now we go to 75. It's just about in place with the other teeth. And we continue with this. And we use this wire back then, sometimes straightening things up, where we took out the first, I took the bicuspids, I thought, on the case. Let me make sure here. All right. All right, we did take the first bicuspids on the bottom teeth, on the bottom out, and this is the second molar, second bicuspid, and then there's both molars in place right there. And this was 75. We still ain't gotten that tooth back up in place where it should be. And here's 76, and now the root of that tooth is out with the other teeth right there. And you can see up above we did not remove any bicuspids. We took them out only on the bottom arch, and so the molar bicuspid relation will be a little different. We've got the midline now lined up, and this tooth, the root is out where it should be, and the rest of this is going. It's 1976. And here we're going where we didn't take the upper bicuspids out, so there'll be a little extension of where the lower molar will be meeting under the first, the bicuspid of the up above. So this is 1977, and the teeth are lined up, and this is 4 of 77, and this is here, and you see the root of this tooth is right where the roots of the other teeth were, and we're lined up good. And we took these cuspid teeth and brought them back, but we didn't just spread them out like this. We spread them and carried the roots back with the crown. And this is watching it for 10 years. Now let me go run ahead of it. Here's 76. All right, this is 77, and we took her out of this, and here is 79, and there the teeth are in 1985. So we started in 73, and here it is in 1985. We had a little wire lined up in there, and I kept them straight. I was just afraid that would go back. But then we're going to take that off and everything. And here is 1985 again. And now they're in there by themselves, no retention on the bottom teeth. And this is 1985, and they're lined up just almost ideal in there. And they have not gone back to that. So experience will show you a more correct way. Now you can learn from other people, and you've got to learn from other people. I'm trying to get you to learn from what I experienced here. So I'm showing you what you can do, and I'm giving you some evidence that it will do it. And so I can look you straight in the eye and tell you, you can expand the lower cuspids, and they don't automatically go back where they were. And that is a fact, and it is something that'll be true 100 years from now. And so this is something that you learn from experience frequently will be better than what you learned from books or somebody else teaching you. But yet I'm trying to teach this, and I hope this is absolutely correct and will not mess you up in treating your case. So people were extracting teeth in the anterior part of the mouth because they thought they could not expand these teeth and keep them. And what the students were in a hurry, and so they didn't have much time, so they just spread the teeth out like this, stuck the teeth in there, and then the teeth would come back again. But if you take the cuspid teeth and go back with the roots and put them where, and the roots are slightly further back than the crown, there's no sacred position for that cuspid to come back over here. It'll tend to stay there. Now you can have other things. You can have habits or something that you can cause the teeth to be crooked, but that is not because of the where the cuspids are. So people believe that, and that's what a lot of information out there today is, that we're trying to learn everything from everybody, and this AI stuff is good, it's fine, it'll bring it up, but it doesn't have the nitty-gritty truth of experience. And there's nothing better than learning that. And you learn, if you go in there and line cuspids up like this, and you know there is no question about it working, then you can look somebody in the eye and say, I can expand those teeth, and they will tend to stay there. They don't have any sacred thing bringing them back over there. You can have other reasons for them maybe lined up, but here it is in 79, and let me go on and get through this. This is 77, 77, and here it is when we started in 1973, and there it is in 93. So I waited 10 years and they didn't go back, and I waited 10 more years and they still didn't go back. And so I had no question in my mind when I was trying to teach somebody that you can expand cuspids and you can get them to stay there. And you see these angle on these cuspid teeth sitting in there like that. So I carried the roots back, but it takes longer to get them back to right what it would than if the cuspids were as crowded as they came in here. You lean them over in that direction. All right, we go on 73. There it is in 93. And here it is in 73. Let's see. Yeah, this 73 is 93. And this is 93. The upper teeth didn't change much. See, they look pretty much like they were to start with. Let's see. Let me go back to 93. See the upper teeth, look at them. This is 73. Here is the case 93. lined up pretty much like they were. This is the lower teeth in 73, and these are the most crowded cuspid teeth. I have never seen a case that had lower cuspids any more crowded than this. This was a perfect class 1 relationship and a perfect closed bite. And if you have a class 1 relation and a closed bite, you have to have crowded teeth. And you can look at somebody and you can look at the side of their teeth and tell them if those are crowded. But if you have all your teeth, they've got to be crowded. There's hardly room in here for 2 of these teeth. And yet we expanded it, and it stayed out there for 20 years, and that was 93. That's been a good many years ago, and I'll guarantee you this lady will carry those teeth to the grave, regardless of how old she lives. They're not going to go back there at any age and thing. And there it was in 93. No, yeah, that's 93. And that's about as straight. There was nothing holding them there in that area. And there it is, 93. So I thank you for watching, and I hope you'll take this for heart, that learning by experience is really better if you can do it. But you cannot depend on having experience enough in your life to learn everything you need to learn. So we've got to go back and stand on the learning of people that have gone before us, and you can come back then and do it, but look at what you are supposed to know or supposed to get from these people and say, is this correct? There's many things I have done in orthodontics that I thank God that I didn't go back through orthodontic school, or I would have learned to do it wrong. And sometimes you learn to do it wrong and you swear up and down that's the way to do it. You take a young elephant and you chain him to something in the ground, and he learns that he can't break that chain loose, and the elephant then, as long as he's living, you can chain him to something in the ground and he'll feel a little distance, and he decides that he cannot take that out. If you didn't learn that from somebody else, so watch what you learn from other people, including me. If it doesn't have good sense behind it, good common sense, don't do it. So, or else say that may not be right, and then go ahead and do that. So this is a question, and there's no question in my mind anymore. From the time that I learned this, I could look people in the eye and say, this is not the way it is. And I don't care what AI says or anything else, that's still the way it is, and it'll be that way 100 years from now. So I'm going to hush up, and I hope that you have learned something from this, that experience is a dear teacher. If you really experience something, you get it down in your head. I mean, that's the way it is, and it's hard to shake that. But if you were taught wrong to do it, and you do it wrong, and you will just swear up and down, that's the way it's got to be. And it frequently is not. So we've got a bunch of things I've learned in orthodontics, and I thank God I didn't go through the regular routine of being taught these things. So I'm going to hush, and I hope you'll pick up the idea. The truth here is experience is a very dear teacher. And when you learn it from experience, you can know it's correct if you have done it correct, and you show somebody around it. And that's the way I feel like it should be. But learn from other people don't try to cover there's no godly way you can learn everything that's from scratch. But I'll pass on here, and I thank you very much for watching, and I'll close out here and say I hope you'll join our channel. And we've got a couple of channels now, and I'm on Facebook and everywhere I look in there. So thank you for watching this, and I'm going to hush up here.